now starting. All attendees are in listen-only mode.
All right, hello everybody. Welcome to the webinar. Thanks for joining us today. My name is Rob O'Connor. I'll be your moderator today. I just have a couple of housekeeping items before we get started. The first is that this is a series, so if you're interested in what you see, I encourage you to go to that URL on the bottom of the slide and sign up for our upcoming webinars. Also, we'll be recording this, so don't worry about trying to notes or anything like that. We'll send the recording around likely tomorrow. And then finally, we really encourage you to ask any questions you might have in the little GoToWebinar console during the webinar, and we'll leave some time at the end to make sure they all get answered. So our agenda today, we're going to start off with hearing from Carla, who is runs the Innovation and Digital Health Acceleration Lab at Boston Children's Hospital. Then we'll move on to Joe, who's at Google Cloud Platform for Healthcare and Life Sciences. And finally, we'll hear a little bit from Jaku, who's our VP of Product here at Convey. So with that, I'm just going to hand it over to Carla.
Great. Thank you very much, Rob. As Rob mentioned, I'm the Senior Director of the Innovation and Digital Health Accelerator at Boston Children's Hospital. Just by way of background, Boston Children's Hospital is a 400-bed comprehensive pediatric care hospital. #1 pediatric hospital rated by U.S. News and World Report for the 3rd year in a row, and a long history of innovation from early days of Dr. Folkman and angiogenesis and Dr. Enders and polio, and now we feel like we're a critical piece of driving innovation in digital health. My background is in business and marketing consulting in the healthcare world, also in the startup world, but probably most importantly in my time at Children's, I've worked with well over 100 innovators at the hospital, and it's all about enabling them to be the best innovators that they can be. Before we launch into a talk about the future of healthcare, I just want to reflect a little bit on history in just sort of a fun fact way. So specifically, I'd like to ask you to ponder when you think the concept of temperature and the establishment of a baseline temperature of 98.6 was established, and think about that question and we'll come back to it later. So our mission in the Digital Health Accelerator is to shape the future of healthcare and extend Boston Children's Hospital reach globally. And the way that we do that is we go deep to our core competencies, which is our clinical expertise, the data that we sit on, and our burgeoning healthcare IT development capabilities, and blend that with critical industry partners, major players and startups alike. And our goal is to launch commercially successful products, platforms, and ventures. Our team is about 40 people strong. We're constituted like a startup within the bigger enterprise of Boston Children's Hospital, which is meant to allow us the agility for partnership formation, product development, and to the best extent possible, implementation as well. We're a cross-functional team with expertise in software development, data analytics, clinical care, and lean startup practices so that we can work together on the acceleration initiative. About half of our team are technologists, which is really important to enable us to do what we're doing. We have deep technical expertise in informatics, genomics, data science. We offer our innovators and partners alike a breadth of experience developing mobile apps, web apps, data algorithms across a range of delivery methods, including telemedicine, remote health, and decision support. And given that we are innovating from within the healthcare system, we have developed pretty decent capabilities in the area of EHR interoperability. In fact, we have someone on staff who was at the White House last year working exclusively on developing FHIR standards, and now he's working on making our apps an initiative FHIR-enabled as well. So there are 3 areas that we focus on as a team. The first is digital health strategy, and that has 2 components. One is enabling us to provide care for our patients regardless of where they are around the globe, the one-to-one, using things like virtual visits, care coordination, second opinion, things like that. The second component of that is we really are focused on providing and changing pediatric care globally by providing care one-to-many. And the way that we're doing that is embedding our know-how and our technologies in other organizations and technologies. So, for example, we have a partnership with GE where the pattern recognition behind radiology exams is powered by Boston Children's Hospital. Another partnership with Withings, who just announced yesterday their new Thermo device. It's a new thermometer, And the app that helps interpret the temperature information is powered by Boston Children's Hospital. The second piece of what we're doing is accelerating the innovations that are coming through the organization on a grassroots basis, and I'll talk a little bit more about that. And then finally, because we do have such deep technical capabilities, we are the digital core for new innovations coming through the hospital, and we can provide resources to our clinicians and staff alike. When they have ideas, we can help build out their technologies. So core to our digital health strategy are partnerships. We're forming partnerships with large, small, and startup industry leaders in connected health, remote health, patient and clinician decision support tools around technology platforms as well. We have partnerships with Cerner, with Uber, and I'll talk a little bit more about some of our initiatives. So this is a sort of a sampling of our projects that we're prioritizing and accelerating. Some of these are emanating from our Accelerator grant program, others from our digital and informatics research team, and others still from our digital core initiative. Just one example, and I'll talk to some others as well. POP is one of our very first projects that we are accelerating through our Accelerator grant program. It's a predictive algorithm that determines within 10 to 30 minutes of someone going through triage and ED as to whether they'll be it or not. We think that has great potential, and we're getting that ready for pilot in the fall. So let me just walk through a couple of projects that we're working on to give you a sense of the portfolio that we have. So KidsMZ is our suite of consumer health digital tools for patients and families. It's delivered across a variety of digital media. So again, this is another way that we're extending our pediatric expertise beyond the walls of Boston Children's Hospital. We were the first organization, first healthcare institution to write a healthcare skill for the Amazon Echo Alexa product. And that was an opportunity and is an opportunity for parents around the globe to help interpret what's going on with their child around common maladies like fever, sore throat, rash, that sort of thing. And then, as I mentioned, we have the partnership with Withings. We have a similar partnership with Ring as well, and some others in the works. Crowd Clinical is another project. It provides another way for hospitals to listen to the voices of patients and families using a combination of supervised machine learning, natural language processing, and manual curation. Crowd Clinical systematically identifies and rates hospitals based on tweets discussing the patient's experience and their experience receiving health care. So we think this is important to be listening. It's real-time data, which is a nice supplement to the traditional survey data that hospitals are often using to manage quality. And interestingly, the findings from these analyses are correlating with readmission rates, probably more importantly. Strabistic is a brand new, newly released app that was developed by our team and the Chief of Ophthalmology at Boston Children's Hospital, David Hunter. It enables clinicians to remotely monitor and assess eye alignment before and after corrective surgery for strabismus, which is the diagnosis of misaligned eyes. It's a HIPAA-compliant photo messaging platform that guides patients through the complex workflow of posing for and capturing the 9 diagnostic images that physicians need to monitor the condition. And this is an idea that Dr. Hunter came to us with in December, and we launched it last month. So that's sort of testament to our ability to move in an agile fashion. Disco is a discharge support tool. There's a lot going on in this space, obviously, but this is somewhat elegant in its simplicity. Basically, patient families are contacted post-discharge through their preferred means of communication, whether it be text or email, and ask 3 simple questions that we know correlate to readmissions. And then the feedback from these interactions are tracked by the care team via dashboard, so we can tell quite easily who needs follow-up attention and who's just fine. Given that this is more efficient and patient-centric than the prior methodology of attempting to reach patient families by phone, this technology is spreading across units within Boston Children's. It's been very well received. So Circulation is a brand new company launching this year in the arena of non-emergency medical transport. It offers a HIPAA-compliant, cloud-based software tool designed to help triage the right ride for the right patient by bringing the on-demand convenience and efficiency of technologies like Uber to the world of non-emergency medical transport. It aims to extend the low-cost, on-demand concept farther into healthcare. And we know from working on this so far, patients can get to a doctor for whether it's an acute care appointment or post-discharge appointment. On their way home from discharge, they can stop at the pharmacist. So it offers a lot of convenience and we know it's more cost effective as well. So this is launching, as I mentioned, just newly launching this year. NeuroMotion is another startup launched out of Boston Children's. It was developed by a team of researchers and clinicians in psychiatry. It's a brand new treatment model for children with behavioral dysregulation and anger management issues. Using a digital therapy coupling biofeedback and gaming, children are reinforced for regulating their behavior. And the clinical studies are showing that using this technology can have higher effect size than medication, which is incredibly important in this arena where people are concerned about medication and children, obviously. The company's launched and they're seeking funding at this point. Crisis Care is an app that was developed by a team of clinicians that work with suicidal teens. It incorporates cognitive behavioral therapy techniques into an app that is unique because it offers two modes, one for the parent and one for the teens. So it enables them to think around what are the tools that are helpful for helping that teen cope and manage depression and stress and suicidal tendencies. So at the beginning, I asked you to think about fever. It turns out that the baseline about what constitutes a fever was based on a large study by German researcher Karl Wunderlich in 1868. So it turns out that we've been working with that information as a baseline for almost 150 years, and in pediatrics it matters a lot. A two-month-old infant will be hospitalized based on what that thermometer says. And we know in this day of an age of crowdsourcing and technology that we can do a lot more around that. So led by a clinician team at Children's, we launched the Fever Prints Health Kit app in March. We're already seeing fascinating data that we know has the power to provide physicians with better data to use fever as a tool for improving medical diagnosis and care. So that just gives you a sampling of some of the things that we're working on, some of the projects in our portfolio. I'd like to talk a minute about the Accelerator Model. This is our discipline process around stimulating and scaling innovation. It starts with cultivating ideas from within the hospital, from within our broader ecosystem, Boston and across the globe, really. And we do a number of things around that. We have events like hackathons. We actually are having a kids hackathon on October 1st, which you can stay tuned and listen for. We're going to bring children in, and using the Minecraft technology, we're going to have them help us design the hospital of the future, because we're about to move into the stages of developing a new clinical building, and we want pediatric patient input on that. So that should be a fun event, and we've used that. We were the first to offer a pediatric hackathon 2-3 years ago, and that model has been quite successful. We've evolved it substantially to be quite productive as well. We've seen companies spinning out of some of our hackathons. So we do things like hackathons, we do events internally, and that's important for stimulating activity, but also our Accelerator grant model, which I'll talk about, is important. And then we have a disciplined process for evaluating those ideas and very high-touch support for allowing those innovators to feel supported and giving them the resources they need to scale their ideas. I can talk a little bit about the Accelerator grant process. So anyone at Boston Children's Hospital is encouraged to apply. It's a rolling application. We changed, so this is a newly built program. We've been up and running for about 6 months. And it is designed quite particularly based on our experience of working with innovators within the hospital, as well as our Chief Innovation Officer being an entrepreneur himself within the confines of Boston Children's Hospital. So we knew at that point what the gaps were, and we built this to fill those gaps. So first of all, it's a rolling application. We don't think innovation or innovative ideas happen once a year or twice a year. So we take applications on an ongoing basis. And then what we do is, a new element that we've added to this is called the opportunity sprint. And this is our opportunity to sit down with the innovator, bringing the right players and the right resources into the room. We sit down for a 90-minute deep dive using the Lean Canvas model as a foundation, although we've adapted it to our situation. And we'll bring in the room the technologist that's appropriate for whatever technology the innovator is proposing, the business support, the business analyst, the project management support, the innovator, the clinical perspective, and we do a deep dive for 90 minutes, and that innovator will walk out of the room with, in essence, a mini business plan that helps them to shape or pivot their product accordingly. And that's been incredibly well received. We did about 24 of them in January, 17 of them in May, and the feedback we're getting is just incredible. Even people saying who didn't get funded that this was the most beneficial grant they'd ever applied to. Our goal is to create learners, obviously, in our learning environment, people who are learning about the innovative process. And the winners of the grants have the opportunity of winning funding through seed grants, software development, or a combination of the two. Another key element of our Innovation Acceleration Initiative is our advisory board. These are people, VCs, strategics, entrepreneurs themselves, who help us select the projects as well as to keep us honest and moving them forward based on rigorous milestone progression. And then finally, because we know it's complex to navigate your way through the innovation process, particularly in an academic medical center, we've built the Innovators Red Mask. This is on our website. I encourage you all to take a look at it. It's open to anyone. And feel free to go online and download it. It just walks you through the process of digital health innovation from the perspective of doing that within a clinical setting. So thank you for your time. You know, for those of you who are in the Boston area, I encourage you to stay tuned to our events, things like the Kids Hack. We're going to have a showcase later in October. And for those of you interested in partnerships, feel free to reach out to us. Now I guess I'm turning this over to Joe.
Great. All right. Thank you very much. I'd like to thank Carla for that great presentation, as well as our host at Convey for inviting me here to speak today. So I'm Joe Corkery. I'm a product manager on the cloud platform at Google, where I'm focusing heavily on healthcare and life sciences enablement for the cloud platform. And that's what we're going to be talking about today in a little bit more detail, talk about the cloud platform and what we're doing to help healthcare and life sciences companies be successful there. So before I really dive into the cloud platform, I want to take a moment to just think about Google in a larger context. Google's really been a pioneer in the world of data analytics. As many people know, we've grown to support many applications. We have more than 7 applications which are serving over 1 billion users each. And in order to serve billions of users, we've had to grow a global infrastructure and build out a wide variety of data analytics tools to understand how to provide that infrastructure, how to maintain that infrastructure, and then gain insights from that data. And so we've been had a lot of success with doing that, enabling us to provide a wide variety of globally used applications. And what we've done as part of providing Google Cloud Platform is that really enables users to apply our expertise to their own data problems. Our goal is to make it easy for anybody else in the world to come and take advantage of the infrastructure that we've built and benefit from our expertise. As an example of this, as I mentioned, Google has been this pioneer. As part of building out this infrastructure and this technology, we invented things like MapReduce. That was invented years ago, which then we made available and open to the world, and is now transformed into Hadoop, which has been one of the big foundations of the big data world. Most recently, we open sourced a tool called TensorFlow, which was the engine behind Google's machine learning technology, and is now available broadly to the world as well. And back in March, we made that available as a managed offering on our cloud platform, so you can just come bring your data to it and build machine learning models with it. So, as I said, the Google Cloud Platform, it allows you to run your applications using the same infrastructure that runs Google. So you can take advantage of all the investments that we've made in data centers, in security, in hardware, infrastructure management. And we do this because that allows you to focus on patients and not infrastructure. So you can build your applications and technology and focus on providing care, improving clinical outcomes, and not having to worry about, how many resources do I need to provision to ensure that this stays up, and worry about latency and where your data centers are. We're really trying to make it so that you can focus on your area of expertise and we can focus on ours. Now, this wouldn't be a discussion about healthcare if I didn't spend a little time talking about security and compliance. This is something that is near and dear to us at Google and on the cloud platform. We were the first cloud vendor to receive FISMA certification, the first to encrypt all our data at rest, also encrypt all of our data in transit, received a wide variety of important industry certifications. You can provide secondary customer encryption via the customer supplied encryption keys tools. You can confine your data to regions if that's important to you. But importantly, it allows, working in the healthcare world, we sign business associates agreements, so that way you can take your HIPAA-covered workflow and bring it to the cloud and run it on the cloud. And one of the unique features about certainly our BAA is that it doesn't cover it's not limited to the infrastructure you're going to run on. So you don't have to worry about, I can only use these specific compute instances, or I can only use these specific regions. It covers, the application or the service that you're using, not the hardware that it's running on, or it's not limited to a specific set of hardware that you're running on. Now, I want to talk a little bit, so a couple examples here. We've had some customer success. We worked at the Stanford Medicine Clinical Genomics Service. This was a service that was started as a pilot back in January 2014. And for those of you actually, so I don't have time to really go into a ton of detail about it, they gave a great presentation at our GCP Next conference back in March. So if you'd like to hear in more detail about that, I encourage you to search for this on YouTube and you can find the details there. But at a high level, what they were trying to accomplish is finding out whether they can apply genome sequencing to determine underlying disease in patients with suspected genetic disease and see if that can translate to a clinical impact. And they focused on 4 major disease areas. And what was nice is that they actually were able to demonstrate success across multiple individual cases in their pilot, which transformed into clinical diagnoses, and with those diagnoses was able to translate into a real change in treatment path and clinical outcomes. And so based on that success, they decided that they needed to ramp this up into a production service. And in order to do that, they faced some key compute and storage challenges. And one of the challenges that they have to build this to scale with an uncertain ramp up. So genomic data can be quite large. And it's well suited to the cloud, but when you're looking at an uncertain scale, you need to be able to basically provision new compute and new storage relatively quickly without having to worry about a cycle of onboarding. And they also needed to find a solution that would, the clinical genomic service was actually, across 3 different institutions. So they needed someone who could meet all those security legal needs through a BAA. And then they wanted to find a solution that had experience in the genomic space. And so this is where we were able to come to the table with our Google Genomics offering, which is on the cloud platform. We're able to provide that easy scale, elastic computing ramp up on the cloud, but also able to really meet that some of that industry value add by taking the Google Genomics, which really what it is at the core, you take advantage of the compute and storage capabilities that are inherent in the Google Cloud Platform, and layered on top of that are the great data analytics tools, like a tool called BigQuery, which allows you to scan over extraordinarily large data sets very quickly, and then layer on top of that a genomics-aware API that allows you to understand that the data that you're interacting with, asking queries of, is actually genomic in nature, and then supporting the Global Alliance Genomics and Health API, so that way people are able to bring applications that have been built elsewhere against other genomic stores to this location. And so that's just one area where we're really expanding in the space. Now, another area which we've seen a lot of interest in has been in telemedicine or teleradiology. This is an example here with an organization called MNES based in Japan. They have a nice blog post on our site with more details. But the story is that in rural Japan, it's very hard to get access to radiology resources. Number one, there aren't a lot of scanners in remote regions, and 2, most of the radiologists are clustered in the city centers. So most of the radiologists are either in Osaka or Tokyo. And so what MNES did is they actually took a van or a truck, I forget the specific, and took scanners out into rural Japan for patients that needed them, did the radiology there, and then transmitted the imagery back to the radiologists in Tokyo or Osaka via Google's Cloud Platform, and that will allow them to do those reads remotely and then provide the diagnoses that they need. Now, the last thing I'm going to touch on here is one of the things I'm really excited about and we're excited about on the cloud platform is machine learning. And when you bring great data to a problem, you get lots of great opportunities. And we've already seen this already with what we've called the Cloud Vision API, which was built using a wide variety of imaging data. And it allows you to, you can provide an image to this API, and it can find faces. It can detect logos. It can tell you, what this is. Is that a cheetah? What's my % confidence that that's a cheetah? Can do OCR, tell you, where in the world you are based on the landmarks you're around. And so this is, really exciting to see what machine learning can do when you give it enough data. And I think I just want to leave here with the thought of, well, what could we do if we're able to apply these type of machine learning capabilities to the healthcare industry with healthcare data. So that's why we're really excited about having made the cloud machine learning offering available on the cloud platform for people to bring their own data and with these analytics. And so I'm excited to see what we're going to do in the future there. And with that, I will transition to Jakub.
Okay.
Thank you, Joe and Carla, for your participation and interesting presentation. So I'm Jakub Venkat, and I'm responsible for product management here at KidsMZ. And as Carla articulated in her portion of the presentation, it can be very, very challenging to come up with these really innovative applications, especially in healthcare, when you really have to worry about security and compliance. And so in this portion of the talk, we're going to quickly highlight how we can make that easy from an application perspective, so you are able to innovate while we take care of the heavy burden of keeping everything secure, compliant from an application perspective. So if you double click on some of these challenges, right, when you're trying to really innovate, and want to realize, take your idea and make a real application that's secure and compliant, you realize you need a lot of different things, right? The first thing is, you need to enable these innovative application developers, give them freedom of choice so they can develop these applications in tools of their choice, what they're familiar with, give them access to modern mobile digital features that enable a 5-star user experience. And you need to also, at the other end, make it easy for them to be able to access these either these healthcare systems like an Epic or a Cerner or Allscripts, things like that, as well as other data sources from a more traditional standpoint, like an SAP or an Oracle or something like that. And lastly, you want to be able to do this in a way so it's easy when you're innovating. You want to be able to iterate really fast, prototype quickly, get some feedback from your user base, be able to go from version 1 to version 2 to version 3 very, very quickly. And last but not the least, you want to do this so you're not worrying about things like encrypting the data, making sure that the data is secure in flight, making sure the networking is very secure. And again, you have to do this all in a very agile way. So what are your options? What can you do here, right? So the one thing you can do is to build all the services you need yourself. Right? We think this is analogous to building a kit car where you're, getting parts procuring parts from everywhere, best-of-breed parts perhaps, and creating this car by yourself, and then you have to manage and operate all of these services you have created. So in the case of building these innovative mobile apps, you'll be building all these services to do encryption, to secure your data during flight, to be able to connect to all of these systems. All these services you'll be building yourself, and then you'll have to have the skills or the team to be able to manage this, maintain this, operate this going forward. For your next app, it's a redo, right? You got to build, get the parts again, build the next car again, and repeat this one more time. The other alternative is to create the factory that enables you to churn out these applications, much like you're churning out cars in the factory. So you all have all the basic foundational elements in place, like the data encryption, like the securing of the network, securing of the actual app itself that is running on the device. And that's really what KidsMZ gives you, right? We provide these cloud services that enable you to either overcome or sometimes even just eliminate these challenges, so you don't have to think about this at all, right? So you take HIPAA compliant cloud-based service. Again, this is running, as Joe mentioned, on the Google Cloud platform, which is already compliant, and that's what we use for our underlying infrastructure to provide these pre-built services. On one side, we give you a very open platform that enables your mobile app developers to use the tools of their choice with the skills that they have, whether that be a mobile app or a tablet or a wearable or any of these smart devices. We provide SDKs across all these platforms that you see here, native iOS, Android, JavaScript, whether it's a web app or a mobile app. We provide an SDK, and this SDK, among other things, does things like data encryption, securing your app, securing your data while it's out on the network, giving you pre-built access to all these back-end systems of record. So you as a mobile developer don't have to learn how to interact with an Epic or a Cerner or any of these other services that Carla mentioned, right? So the mobile app developer, all of that is abstracted from you because KidsMZ is doing the heavy lifting of translating that to the appropriate queries and accesses into these backend services for you. And we, in the spirit of allowing you to innovate and iterate rapidly and operate in a very agile way, we separate the front-end development using these SDKs as an abstraction layer from the back-end development. So the front-end developer, again, can proceed at their own fast pace, and the back-end integration happens completely in parallel with it. And if the back-end changes, it doesn't impact the front-end at all, because we have these built-in integrations that are completely abstracting the back-end. So that's what the KidsMZ platform provides. Again, it's running on the Google Cloud platform. We have a BAA with Google, and in turn, we can do a business associate agreement with you, the customer, that covers our services. As you know, HIPAA compliance is shared responsibility, and we take responsibility for the services that we provide. And here are some examples of organizations that are using this platform to build these innovative apps. We have Thomas Jefferson University, their entire innovation team or innovation lab is building all of their, we are the innovation platform that they are building their apps on. Janssen Pharmaceutical has an interesting app that you can go check out on the App Store called Gut Check that deals with inflammatory bowel disease. And there are many other apps that they're also building on us. So it's Sanofi, Merial, which is a pet health company that's building a pet health app using this platform. Amgen is, again, building a variety of different innovative applications where we are their digital platform. Sunsprite is another interesting application for people with depression to be able to use to track things like light and exposure to light and stuff like that, and Autismate, obviously targeted at autism patients. So those are some of the few examples of people that have used this platform and leverage this platform to save them time, effort, complexity to build out these innovative applications. So that's all I had for my section of the presentation today. I'm going to hand off to Rob now to so we can tackle any questions that folks might have.
All right, thanks everybody. We got some good questions, but we still have time for more. So anybody who has anything, if they're still curious about, please drop it in the questions area. So we had a couple of good ones for Carla. The first is, given how complex the academic medical environment is, how do you innovate within that complexity?
Sure, that's a good question. I think, the benefit of being in an academic medical center like ours is, as I mentioned, innovation is in our DNA. So I think there's no lack of ideas, and it's really about sort of empowering and enabling the clinicians, often the clinicians, sometimes the staff, to sort of move forward with those ideas. And that's why we've been very mindful of shaping this accelerator around their particular needs. So, what we're finding is oftentimes this is not their day job, and they actually don't want to leave and make it their day job. So we're wrapping resources around them, things like project management, business analytics, and then the tech support as well. And initiatives like what Convey is doing is going to be incredibly useful for innovators in that setting as well. So it's paying attention to the time they have and the resources they have, and then adding to that where we can.
Great. And this one's simple in, well, it sounds like it's simple, but I don't think it's going to be. What makes for the most effective pilots?
Yeah, so we often get approached by startups who want to do pilots in the clinical setting, and it's so important, obviously, to validate ideas in the clinical setting. And, so often, and I think everyone knows this, but you can't be reminded too often, it can be 20% a technology issue and 80% a workflow issue. And so what we do is we very carefully design the pilots, engaging the right players. It's critical to have a clinical champion. If a startup wants to do a pilot in our environment and there is no clinical champion, it's not going to work, and it's not something that we're going to support. It needs to be a true clinical need, and I think sometimes you can't emphasize that enough. It can't be an idea of a need. It has to be really based on what the clinicians are experiencing, or the patients, or the parents, or their families, or wherever the pain point is. You really have to understand that to great extent. And then really designing the pilot with all the key players involved and working through the organizational issues as well as the workflow issues. Those are two really critical things. I can't emphasize enough the importance of understanding how it's actually going to fit into the workflow of how an institution like ours works, or what the patient experience.
Great, thank you. Joe, here's a question for you. What does it actually mean to be HIPAA compliant for a cloud platform? And I suppose a follow-on that Jaku could answer would be, what does that mean for like the mobile apps layer as well?
Sure. Let me just come a little closer, Mike. Yeah. So, what it really means is most people are aware that, HIPAA compliance isn't actually a certification that you can go and receive. It's a assessment of risk and liability that is, codified in this business associates agreement that the provider enters into with the customer, saying that they have gone and done the appropriate security reviews and controls, and all of that is in place so that the data that you put on the cloud platform is going to be appropriately managed. Basically, we're going to be a great steward of your data. And as we mentioned before, at least the cloud platform, we're happy to sign BAAs with HIPAA-covered entities. And one of the things that's unique about our offering is that it covers the actual cloud services as opposed to the underlying infrastructure. So that way you're not limited by what resource you can use, what region it's located in. You just know that, all right, I'm using Compute Engine is covered. But one of the things that's important to remember is that this is a shared responsibility. We'll sign the BA with you, and we'll be a good steward of the data that you provide to the cloud platform. But you, as the application developer, have your own responsibilities that you have to bring to bear with that. And actually, it's a great transition. Chiku.
Yeah, thank you, Joe. So as Joe said, this is a shared responsibility, right? So Joe and the Google team take responsibility for all of the cloud services, and then we have all the KidsMZ backend services, the SDK we provide, and so we take responsibility for all those services, and we ensure, there's a whole bunch of safeguards that you would have to ensure that are technical, physical, organizational, training, breach notification. And we have policies and procedures in place within our organization and within our software, so we can handle all of those safeguards, and that's what enables us to sign the business associate agreement with our customers.
Just a question around that. When do you advise people to start thinking about that in their development process? Because it's something you need, obviously, ultimately, but how early should they be thinking about these things?
For us, when customers come to us, we tell them right at the beginning, right? For example, one of the things we like to talk about is the fact that if you're using the KidsMZ SDK, you're securing the application by design. Because you're using the SDK ensures things like the data is always encrypted, the communication is always secure, and things like that. So it starts from day one, because otherwise the problem just becomes more complex.
Yeah, I would agree with that. If you're going to be playing or developing applications in the healthcare space, regulations should be at the front of your mind from the beginning. Those are in order to really be successful, you have to have a great story around this. You have to be able to handle it well, and it's not something you want to try to layer on at the end.
Cool. All right. Well, those are all the questions we had. Thanks again, Carla, Joe, and Jaku. Thank you, everybody, for attending. Again, if you found this interesting, we have 2 more of these in the series coming up, so highly encourage you to go seek those out and sign up for them. All right, thanks.
Great. Thank you.
Thank you.